Hi, everybody. Let's discuss a little bit about symptomatology of fibroids. So when we look at these fibroids, we said that these kind of fibroids are benign growths that arise from smooth muscle and connective tissue and within the wall of the uterus. They could be in various locations in the wall of the uterus. But let's discuss now how they present to us. Around 40 to 50% of women actually may be asymptomatic, which means they are not even aware that they have fibroids, and it's only a coincidental finding when a scan or an examination is done on these women. But if they do have symptoms, what kind of symptoms do they normally present with? Number one, they could present with symptoms that are period related, which would mean they come with abnormal uterine bleeding, which might be mainly in the form of increased flow. It could be irregular bleeding depending on the extent inside of the cavity, and sometimes it could have a little bit of pain, especially if you have a fibroid that is within the cavity being pushed every time she has her periods. So submucous fibroids could have even some pain with the heavy periods. If it is not that, then they would present with pressure symptoms. So depending on the size and the location, they would have different pressure symptoms. So we have to understand that this uterus has surrounding structures to it. We have the bladder in front here, the vagina down there, the rectum behind here. And these symptoms can be, we have the ureter passing on the side. So if this has fibroid and grows bigger and it now presses on these structures. So if it's anterior, it will have press on the bladder, giving symptoms on the bladder frequency, maybe sometimes even repeated or frequent urinary tract infections, or incomplete emptying of the bladder, or sometimes pain while passing urine. So you have different symptoms related to bladder. If it is on the back side and it's pressing on the rectum, then you may have symptoms like constipation, symptoms of incomplete emptying. Sometimes depending on the extent of pressure and involvement with other disease, sometimes you may get pain while passing stool. If it is on the side and it's big, it's heavy, it could press on the ureter and start causing hydroureter and issues with the kidney. So these are called pressure symptoms. Sometimes you just feel heaviness in the abdomen. It's a big abdomen, it's growing, you feel some mass there. So it's heaviness in the lower abdomen and pelvis. So these are called pressure symptoms. And then sometimes they present to us with issues related to fertility and or pregnancy complications. So if these fibroids are going towards the inside, if they are near the opening of the tubes, they might compress and cause tubal block, they might cause poor implantation, they might cause miscarriages, they might cause preterm labors, they might cause those kind of complications related to the fertility. So this is how these patients normally present to us when they have fibroids. Thank you very much.